Well, it's a new year. We want to give you some tips to keep your heart healthy in 2022. I'm now joined live on the phone by Dr. Daniel Munoz, the Chief Medical Officer at Vanderbilt Heart and Vascular Institute. So, Doctor, good morning. We appreciate you joining us to share this very vital information with the community. But I want to start by asking you, how does this time of year, during the winter, how does this compare to other times of the year when it comes to heart attack deaths, and why?
Well, thanks for your question and your interest, and it's great to be with you and your audience. So, the holidays and the winter are, for many of us, a time of great joy, but, it can also be a time of significant stress for some, and that stress can take the form of physical stress, emotional stress, financial stress. There are no shortages of stress in this day and age, and we know there's a link between stress and some of those stressors and heart disease and heart vulnerabilities, and so we do see during the winter months an uptick in what is already a very common form of disease, and that's heart disease, the number one killer of men and women in the U.S. and throughout the world. And so we really try to get out the message and emphasize the message that it's really important for folks to be aware of key warning signs of heart disease or heart attacks, sudden chest pain, sudden shortness of breath. Any sudden chest symptoms ought to be evaluated in a very timely way because we know that the sooner we recognize a heart attack, for example, the better the chances of treating somebody effectively and giving them a good quality of life going forward. So don't ignore symptoms, don't ignore new warning signs, listen to your body, and please seek medical attention if you experience anything really out of the blue that's concerning.
Well, no, that's all such great advice. I also wanted to ask you, Doctor, as we're starting the new year, a lot of people are setting resolutions. When it comes to their heart health, what are some tips that you can advise, as far as keeping your heart healthy as we're starting 2022?
Yeah, no, thank you for the great question. I will say that in my line of work, I treat people with heart attacks, but I also like to say that the heart attack that I enjoy treating the most is the one that never happens, right? And that sort of success is because people put into place the right sort of lifestyle tactics to live long and healthy lives free of heart disease. And so when I think about sort of the blocking and tackling of prevention, right, of health maintenance, of staying well when it comes to heart disease and avoiding it, it's really in two broad categories. One is in getting your steps in, right? Mm-hmm. Setting patterns of activity and exercise that help us in any number of ways, including with regards to heart health. And my advice to people on that front is to be purposeful but realistic, mm-hmm. right? We don't need to all become extreme athletes. But rather setting realistic goals and getting our steps in every day and doing physical activities that bring us enjoyment. And that's different for different people. And then the second category is in the food department. Mm. And rather than the term diet, I actually prefer and talk to my patients not about dieting, but about smart food choices, right? When I think diet, I think about trying to eventually fit into a tuxedo or a dress for some, right? But with smart food choices, it's really about setting the right patterns and doing things that are healthy and sustainable. And those key things, right, the physical activity and exercise piece, and then the smart food choices are as powerful really as any medication can be in terms of letting people live longer, healthier lives free of heart disease.
Such great advice. Dr. Munoz, thank you so much for your time this morning. We appreciate it.
Thank you. Be well.